Well, we have 15 short minutes with me talking now. Again, my job is I am a professor at Long Beach City College. I teach chemistry, and I know I've got some students and former students in the audience tonight, so I'm so glad to see your names popping up here. What I would like to share with you is a few practical things to think about as you are getting from your seat in your house or your car or wherever you are tonight to these careers that we've been hearing about, because as you've heard, it's a long journey. So I'm going to go ahead and share a PowerPoint presentation with you to do that. And so we heard about some destinations so far tonight. Now I'm going to talk to you about what's in red here, the pathways, and then you'll move into conversations with not only our panelists, but we've got about 18 other groups of people that are ready to talk with you and help you navigate from where you are now to where you would like to end up, because it's a long journey and it takes a lot of forms. All right, so exploring those pathways, almost every single pathway here goes through chemistry. Sometimes you might think chemistry is that hurdle you have to get over. As a chemistry professor, I like to think that chemistry opens doors to so many professions. So framing it as an opportunity. And how to get from here to there, like you heard, my expert friends, all the people I've recruited to be here tonight, they are the best people to talk to. So ask them whatever you're wondering about your journey and how to get from here to there. So you might tend to think, or maybe before you arrived here tonight, you might have thought wherever I am, high school or community college or another college, it's just going to be a straight line to that dream career. And I think as you heard all the conversations tonight, there's a lot of different ways that life can work out. And in general, it looks a bit more like this, more like some cycles, figuring things out as you go. And we're going to talk about that. That's okay. That's normal. So I have 4 kids. The oldest 2 are in high school. One's actually a senior, and they get asked this question all the time. What do I want to be when I grow up? What do you want to be? And I want to just reframe one word there and say, who do you want to be when you grow up? Because it's not like you're going to grow up to be a statue of a physician or a star or a house. Okay, those are what? Those are nouns. But you're still going to be a human. You're still going to be the person you are today, just with some new skills and some new talents. And so don't forget, it's who, not what you're going to be becoming. Now, that's a big question. Scientists love questions. All the people that you heard here tonight love questions. And so to help us solve that question, I'm going to borrow one perspective that you might find helpful. You can use the scientific method. And so if your question is, who do I want to be when I grow up? You're sitting here at ask, and you can learn, you can experiment, you can analyze, and then you can figure out, oh, okay, well, I want to get an degree in psychology and be an LMFT, or I want to get a degree in immunology and be a physician. But it starts with this whole cycle. We have steps we can go through. I also want to offer to you, and there you are, figuring things out, reaching for the stars. Another way to approach this giant question of who you want to be when you grow up, we could borrow from health. So in health, we talk about evidence-based practice. In other words, we're treating a patient, not just based on how I woke up and felt that morning. And one way to look at evidence-based practice is with 3 parts. That when we treat a patient, we learn the scientific evidence, maybe read some journal articles, things like that. We also do, so you have your clinical experience that you rely on. And then you also have to take into consideration the patient's values. And you heard bits of that from some of our clinicians that were here tonight, getting to know what's important to the patients, what language they speak, what their background is. And when you take those into consideration, learning and doing and who that patient is, you have a better treatment for them than if you only looked at one of those. And so we can take that to being students and to figuring your careers out. You can learn knowledge from your classes, talking to people, careers, things like tonight. You can do things, and then who you are. You got to figure out who you are. We're all still figuring that out. I think you heard from our panelists, they're all each growing in their careers now. And so I'm going to stick with this learn and do and be kind of perspective as we go tonight. And along with that, got these 2 ways. We can have a method, we can kind of see what overlaps here. Along with that, I just want to plug in something that we've heard from a lot of our panelists tonight. There may be moments where you feel uncomfortable or challenged or confused or overwhelmed. We all have those moments. Those are not reasons to quit. You might feel like you're deep sea diving instead of reaching for the stars, all right? Realize that you're at a frontier. You're pushing to the edge, and we've lived through a frontier of medicine this year, and it's not been pretty in a lot of ways. But those frontiers, scientists hit them with a method. You may feel down, you may feel difficult, you're uncertain, but you're exploring. You're thinking about what interests me today, what doesn't. Often what doesn't interest you is just as important as what does. I think it was Jeanette said nursing just didn't click for her. So that helped direct her to public health. What unique challenges do you enjoy? At the frontier, when we send like a space shuttle up, we don't do that anymore, but a mission up, we want not all engineers or not all physicians, maybe want an engineer and a physician. So what do you bring to the table? And as you start to go through those things at the frontier, you will grow in your skills. You'll start to feel, yeah, I belong here. Things might go right side up. And then you're leaning into that method. So just kind of think about those big picture things as you go through your days. You're at frontiers in your education and in health and in just working in the world. So it's going to be challenging, but you can do it. Scientists, I think, like I said earlier, see questions and challenges as opportunities. And if you need to, stick that on your wall. So when you have questions and challenges tomorrow, studying for your exams, it's an opportunity. And here's an $85 million experiment up on Mars right now, right? There's a frontier. This is not an easy task, right? Frontiers are not easy, but they are exciting. They are earth-shattering. So shifting from those big picture perspectives, I'm going to spend my last couple minutes with you here looking at some practical things, some of the things I saw some of you asking about in the Q&A. And if nothing else, these maybe give you some words to start asking people about. And if there were any words you heard tonight, like postdoc or PI or LMFT, if you don't know what those words are, don't ever be shy to ask people, and don't be shy to Google things too. I Google all the time for words I don't know. So as you're looking for these careers that we've been talking about tonight, high school or community college, maybe you start at a university, some of you high schoolers maybe will go directly to a four-year school. You're going to eventually all end up at a university to get a bachelor's degree, and you might get a bachelor's level job, or you might get one of these graduate degrees. Or, like we heard some of our panelists, they might get a bachelor's level job and then decide they want more school and continue to get more degrees. Degrees often help you learn more about something you're very curious about and might open up a career opportunity also. So there you are, chasing those jobs. Now, we only saw just the tiniest snapshot of jobs tonight, even though it was 8 wonderful panelists. If you want to learn more, there's a couple of awesome websites linked on hanlab.com/LBCC. So you can check those websites that are linked there. So looking at our pathways, I just wanted to quick highlight a few of the guests that are here tonight. We have guests from various universities at the undergraduate level and then also at the graduate level, and I'm so grateful for them. Look for them, especially in our resource guests breakout rooms in a few minutes. And then next up, we're going to look at those practical things. You're like, okay, I want to volunteer, but what should I do? I can't tell you everything, but I can at least point you in the right direction to start hunting. So we're going to break your bachelor's degree years into 2 segments. This is usually how we talk about them in academia. The early college or lower division undergraduate. And you can see that that overlaps back to high school. So if you're in high school or early college or towards the end of your city college years, you are a lower division undergraduate student. And this is a lot of beginning exploration. Then you'll move either at your university or transferring to your upper division undergraduate. And then we talk about graduate school comes after that. And I just want to remind you, you're taking this journey as a whole person, and also you're not alone. All right. So you're going to learn and you're going to do and you're going to be as you go. So during those lower division undergraduate years, and this might again overlap into high school, it might be classes that you're taking, it might be dual enrollment with a community college. A lot of these things kind of overlap between high school and that first year or 2 of college. So you're going to be asking some big questions. What's my major? What college am I going to? My oldest daughter is a senior in high school this year, so she's going through this. You'll confirm that major, think about transferring. Later, you'll be wondering, am I going to go to a job or graduate school? So you'll have some big questions. Be a scientist, hit it with a method, hit it with a pattern. So during those first early years of undergraduate, you're taking classes, and don't be afraid to venture out. Take a nutrition class if that seems interesting. I love food. I kind of wish I was a nutritionist in a different life. Or if you're interested in computer science, like we heard from David, if you take that, data science is an excellent, awesome healthcare field right now. But most of all, one of the key things to be learning in this early college is some skills as a student. So you want to become a professional student in these first few years of college and also in high school. Learn to take good notes, learn to study, learn to tune out the distractions. You also want to start doing things, and you heard a lot of examples of that from our panelists. You want to explore health. And so ways to explore health can take a lot of directions, like you heard from our panelists. Maybe it's at home, like Monica mentioned. Maybe it is through COPE, Google COPE Volunteer. It's an outstanding hospital volunteer program. Or maybe it's through a medical assistant job. That's a way to get into an office and shadow a PA and shadow a physician, kind of see if you like that. Or work. If you have to work on your people skills just because you're around people. Another job that people often do heading towards the medical clinical professions is to work as a scribe. So you're in maybe an emergency room taking notes for the physicians there. But you're exploring, and take that seriously. Put some time into trying things out, seeing what excites you. Another thing you heard some of our panelists talk about is search for those scholarships, talk to people, ask around, and submit your FAFSA every year. Finally, you're becoming an adult now, okay? And so develop your values and strengths. Here, start to learn to take better care of your physical and mental health, because these graduate degrees, they put you in jobs that can be stressful and have a lot going on. So you want to start to get better at that today, so you'll be better at it tomorrow. That was your first few years of college. Once you're in that upper division segment, then you're going to start to think about emphases. Do I want to work with more of a chemistry bent or a biology bent? Within chemistry, do I want to work with the instruments, or do I want to make drugs? That sort of thing. And here you're going to also start to learn professional skills. So professional skills being, now I'm going to have skills that I can apply at my job, not just to be a student, but to go be an engineer, to go be a nurse, that sort of thing. Doing a couple of crucial things in this second half. So if you come to community college, maybe it saves you money, maybe it fits with what your family needs, maybe it gives you a smaller pond to become a president's ambassador and do some big things at the city college. What you can do after transfer, or if you're in your third or fourth year as an undergrad, is undergraduate lab research. And undergraduate lab research is going to help you figure out if those paths that Mario and David took, research, are for you. If you enjoy this, if you enjoy kind of working behind the scenes in the lab, this might work for you. A lot of medical schools, pharmacy schools require this undergrad lab research anyways. So do it in your junior year so that you can find out if this is something you want to keep doing, or you can say no. And you can check in with Cal State Fullerton. Our guest, my husband, Dr. Haan, is here tonight to talk to you about that. You can also intern, like Monica mentioned, and I know Jeanette did some internships as well, if maybe you want to go right into work first before you go from there. And then you're going to have to be applying, whether it's for jobs or graduate school, so you want to be thinking ahead to that while you're in those upper division undergraduate years. Finally, more being, right? Keep growing in your confidence, your habits, your skills. And then you will arrive at that first conclusion, here's my job, or here's my graduate school that I've gotten into. And from there, guess what? Job or graduate school, you're going to learn, and you're going to do, and you're going to be. And so all those things you've been doing already, that whole person, you're going to keep up. And once you've answered all those questions, you heard it from our panelists, next, where does my career go next? I think you heard it from Ardell. He's in a PhD program or a doctorate program right now. And so you start to learn and do and be all over again. I'm still doing that. Even working on this health professions has been a piece of something I've decided to emphasize. So as you can see, getting from where you are today to that health career that's going to have some questions always and some stars. It's kind of just this cycle of doing the same things and getting better and better at them and moving forward to where you look back like our panelists did and say, wow, I've come a long ways. So that's the short story of how to get from here to there. In a human way, here's what that might look like. This is my family. Got me in the middle there getting my bachelor's. My husband and I got our master's together, and we acquired a child along the way who's starting college next year herself. He went on to a PhD and we acquired more children. Twins was a little gift from me to him for his PhD graduation. And then here's my brother-in-law, David, also was up here, but with his PhD just a couple of years ago. And so yeah, it's a group effort and you support each other along the way. So in wrapping this up, we're about to shift where you can go talk to all these awesome people out there. I want to just say thank you to you. Like we started tonight, you are the future of health, and being here with our panelists and with you is one of the most hopeful, exciting things I've done in a year because you are going to make a difference. Just by virtue of the fact that you are here tonight as a teacher, you are the type of students that belong in these graduate careers, okay? They seem a long ways off, but you are my students that want to go the extra mile and want to go further. And so keep that in mind. You should be in 10 and 20 years right where our panelists were tonight. I also want to thank our panelists and guests for being here tonight. It would not have been an event without people who have these awesome jobs. My support from Long Beach City College, and then my friends and family. John, David, Erin is David's girlfriend. She recruited a bunch of people tonight. My daughters, Abby and Rachel, and my friend Marcia Parker, who began this night a couple of years ago. She was a tremendous help and is a real advocate for improving healthcare and making it more inclusive.